Good evening, and thank you for joining us on this program. Your doctor and COVID. I'm Dr. Mahendra Carpen, a consultant cardiologist and the head of medical services at the Georgetown Public Hospital. And it is in my department that we deal with all the patients who are admitted to the hospital with a COVID-19 diagnosis. So today I want to show you something very simple before we start this program. This is a mask. This is what it looks like. When you're wearing it, this is not the right way. This is not the right way. This is the correct way. It must cover your nose and your mouth and not just rest below the nose or below the chin. Now, I'm not wearing a mask in studio today because I'm the only one in here. And it is important that you remember to wear your mask at all times when you're in public and to wear it correctly. I know it is difficult, I know it is uncomfortable, but believe me, it is a lot more uncomfortable to have a ventilated tube stuck down your throat and a machine breathing for you. COVID is here to stay with us, at least for the next couple of months and perhaps longer. We have to learn how to live with it, we have to learn how to deal with it, and it is the only way we can beat it or we can survive properly through this pandemic. If you do not respect it, you can die. Not only you, if you make it through, but you can take it home to your sick family, your sick friends, your vulnerable associates, and they may end up in hospital or they may die. We're not all lucky. We don't know who are the ones who will make it. We have groups that are more at risk and groups that are less at risk, but you never know what your luck is like. So instead of depending on luck, do the simple things correctly. Wear the mask correctly. Wash your hands. Maintain social distancing. Now that we've gotten that out of the way, let me take you to an example way back in late March, early April, when we saw the UK Prime Minister, Boris Johnson, being tested positive for COVID. This was in March 27th. He tested positive. He had mild symptoms. On April the 5th, he was admitted to the hospital. He spent a week in hospital and 3 nights in the ICU. If you've ever spent any time in any hospital's ICU, it is a very frightening experience. And you start to question everything. Will I survive? Will I make it? What am I doing here? What's happening to my friends, my family, my children? How do I make it out of here? The Prime Minister received standard oxygen treatment. At the time, we didn't have some of the more powerful medications and stuff that we are having now, but he managed to survive the ICU stay without needing ventilatory support. That is, he was not put on a breathing machine and did not need any invasive measure, and thankfully he survived. More recently, this week, or last week rather, we saw what has happened to President Trump in the US. He developed mild cough, some nasal congestion, and fatigue and he also had fever. He was taken to the military hospital where he was given a cocktail of medication. He was given what we know can provide some benefit, newer medications like remdesivir, and older medication like zinc, vitamin D, famotidine, and melatonin. These medications, none of them so far has been recognized as a magic bullet. There is no one magic bullet that we have that treats or cures this condition. But we have several that can provide small incremental benefits, and if we were to use them together in the right circumstances and in the right patients, we give ourselves and we give our patients a better chance. Now, we've seen what the best is like to be offered to someone like President Trump. How does it compare to what we have in place for the regular Guyanese? And I want to show you something that was developed in early August by request of the Minister of Health, Dr. Frank Anthony, who constituted a clinical task force to develop the treatment guideline for us in Guyana. Now, this was an early work, and based on available emerging evidence, this has been adjusted so that we are constantly offering our patients what is standard and what is current and what has been showing to have some benefits. So I want to show you what our therapy recommendations are in Guyana for our patients right here, and you can see how it compares to what the President of the United States received. And this treatment in Guyana, we're offering it voluntarily to our patients after they would have given us their informed consent. Informed consent means that we talk to the patients, we tell them about the risks and the benefits and the pros and the cons of using a particular medication or taking a certain medical action, and the patient then has the ability and the information to decide if they want to accept this treatment or this intervention. Now, in our setting, let us look at what is more appropriate for people who are asymptomatic or mildly symptomatic, but they are known to have positive tests. What are the symptoms that we look for? Fever, cough, sore throat, malaise or tiredness, headache, myalgia or muscle ache, without shortness of breath. When these people become short of breath, that is no longer mild. It's moving into moderate or severe. Or when you have an abnormal chest x-ray or an abnormal CT scan. When we first started out this process, we had recommended using hydroxychloroquine or chloroquine, as well as azithromycin in some cases, or in particularly the elderly population, we would recommend doxycycline. What we have seen and has emerged is that there is an improving mortality benefit with medications such as ivermectin. Now, ivermectin is an old medication that has been used to treat parasitic infections, but that has shown to have significant benefits in the COVID-19 population to reduce the mortality and hospital stay and severity of symptoms. This has been shown to be so in big trials in Florida, and this is what we have used to adapt our protocol to meet current guidelines. In addition, as you could have seen from what President Trump has gotten, we also use the same vitamin C. We recommend aspirin in some patients, and we recommend zinc. as well as vitamin D3. These are all the same types of medication that is offered to the President of the United States. In our guidelines and our protocol as suggested, we said that the following may be useful. These are melatonin, which the President is getting, famotidine, which the President is getting, and interestingly enough, in our setting and in places like the Philippines, etc., there has been some benefit that is shown in something as simple as virgin coconut oil. We don't know definitively if any of these here are the real magic bullets. In fact, we cannot claim so for any one medication. But we have some evidence that each one by themselves will offer some kind of benefit. And perhaps when we use them together, there is additional cumulative benefit that can work towards improving the outcome for our patients. So let us summarize what we have learned so far. That we should wear the masks properly, over covering both the nose and the mouth, not under the chin. We should recognize that COVID is here to stay for some time. We don't know for how long, and I believe we are just now starting to see the peak of the infection rate and the mortality rate or the death rate. It's going to be with us for some time. It is our responsibility to learn how to deal with it, how to manage it, how to survive within a pandemic of COVID-19, and how to continue to have the ability to function in society. This is no joke. We can become sick, we can make others sick, and we can cause tremendous harm to our loved ones and those we care about if we are not responsible enough and follow the simple rules, the simple guidelines that are set out for us. I walk around Georgetown all the time, or drive around, and I see people all the time wearing masks under their chin. I see many without masks in crowded areas. If you continue with that kind of behavior, you are going to put yourself at tremendous risk. And here's the frightening thing. The majority of our people who are sick do not know that they are sick. And I'm talking about things like diabetes, high blood pressure, bad cholesterol, etc., genetic problems. Because we have a situation where people do not check their statuses early and when they are younger, they don't really know if they're diabetic. They don't really know if they have high blood pressure. They don't really know if they have any underlying condition. So when they pick up a virus like the COVID-19, it affects them a lot more than if they were actually completely healthy. 30% of the patients who come to me at the hospital with a heart attack, they are now finding out for the very first time that they're diabetic. So if you haven't checked your health status recently, this is something that you ought to do on a regular basis. And if I had my way, every gynaes, by the time they get to 25, latest 30 years old, they would have a chronic disease screen. And what is a chronic disease screen? This would be your weight, your height, your blood pressure, your blood sugar, your cholesterol levels, measure your or get information on your social activities, things like smoking, alcohol consumption, exercise, etc., your family history, your background. And based on those things, appropriate interventions should be done at an earlier age rather than waiting until people get sick and then turn up to hospital. So remember to wear your mask, wash your hands, keep social distancing, and continue to be safe. Thank you.